Hi, my name's Flick. I'm the lead physiotherapist for the Pulmonary Rehab team in Wakefield. This video aims to introduce patients and healthcare professionals to pulmonary rehab. You might have had a referral already, or you might be considering whether you'd like to join us. Pulmonary rehabilitation can benefit patients with a range of chronic lung conditions, such as COPD, pulmonary fibrosis, or bronchiectasis. We hope that anybody whose activity is limited by breathing difficulties will be offered a referral to our team.
So the activity side for pulmonary rehab is a really important component, but there are many other areas that we can provide you some support with. We will provide you some information on your lung condition, how to make sure you use your inhalers as effectively as possible. We'll provide hints, tips and strategies on managing episodes of breathlessness, whilst also improving how you are able to clear your phlegm and reduce your risk of a chest infection. For some people it might be hints around nutrition, for others it might be support stopping smoking. Some of the most important advice that you may learn within the course could be from fellow patients that are attending.
How it first come about, COPD, I was actually at work, doing a little bit of work, and I started getting a little bit out of breath. And then if I was walking up a hill while walking the dog, I got a little bit out of breath, and I thought, oh, it must be asthma. So I booked in to see the doctor, and that's when they did a test and they said, oh no, it's COPD. That scared me. When I was talking to the nurse, she says, have you thought of rehab? Well, I thought, rehab? You wonder what rehab is. And I thought, well, I'll try it. Hope to either help the condition, keep it at bay, or get educated about it. So he's thinking, if I can keep it at bay, then I'll probably live longer. When I first went to rehab, my first lesson, they give you an MOT. And they're rather thorough. And they check your oxygen levels, you check your blood pressure, and then they give you like a little exercise to do, a 3-minute walk. While you're on your walk, they're checking you to make sure your oxygen levels are either coming down or going up, or they're checking your breathing. And then they give you a sheet of exercises to do with times and a warm-up session, and you start doing that. And then as time goes on, you do a little bit more, but they're checking you all the time. If you can't do the exercises, they'll alter it to suit you. And now, with the education, they tell you exactly what the symptoms are, how to manage your breathing, what medications they are, and if you need to change your medication, what to do about it. And it really is a good system. Since I've finished the rehab on my last class, I felt a bit down because it's finished, and it was quite good meeting people of similar condition. But it doesn't stop there, because now I can go on to another 12 weeks at the Aspire Sports Centre, which I've signed up for. So I'm looking forward to that for the next section. And now I'm looking forward to, come the summertime, getting out, going at coast and enjoying life, rather than, being out of breath.
Pulmonary rehab is a fantastic way to improve your activity levels, confidence and quality of life. It might look challenging at first, but the benefits are worth all of your hard work. If you have any questions or queries about the service, please don't hesitate to get in touch with us. Thank you for listening.